I've walked into a brand new office with brand new people. Everyone's really enthusiastic. Everyone really wants to get on with work. So it's great so far.
And were you expecting your list of responsibilities to be as long as it is?
Not really. I expected to get a couple of big portfolios. I like throughout the whole campaign, I was pretty much shouting about health,
Sure.
elderly residential, and the care agency. I didn't. There were some there that I didn't expect to get. And when I met with the CEOs of those departments, I was quite honest with them to say, there are some that I can hit the ground running from day one, and there are some that I will need a couple of weeks to get up to speed on. And they've already got me up to speed on the issues there. Now it's working out the longer term plan for that.
Okay, do you want to tell us which were the ones you weren't expecting to get? Or?
I was quite honest, I wasn't expecting utilities.
So that's Aquajib, Gibilec.
That's right. I haven't spoken to that at all throughout the election. I wasn't expecting that.
You talked about aligning mental health with clinical health services and relocating the mental health service currently sited at Coling Island into the hospital.
This was part of the recommendations that were made to us. And coming from the outside, you think it's a great initiative because you have your GPs there, you have the interaction between the psychologists and the GPs. So last night on the news, there was a clinician that said that wasn't ideal. That wasn't actually news to us because in the course of the campaign, after that announcement was actually made, this issue has already been raised numerous times with us. And what we said is, remember that we're talking about the GHA being clinician-led, yeah? So if it's clinician-led and the clinicians are telling us that this doesn't work, in the course of the campaign, we were already told by clinicians that we might have to rethink this. The message that we want to send out is that we are here to listen. And if the clinicians are telling us that this doesn't work, then we will obviously have to rethink that. And that was something that we actually said during the campaign at numerous meetings. I have no medical background, so I have no intention of getting involved in the day-to-day decisions of the GHA. I think it's important to say that as a government minister, you need to have oversight of the organisation. You need to make sure that the board is robust, because you are effectively handing over control of the GHA completely to this board. But day-to-day decisions are entirely a matter of the board. Policy and policy decisions and making sure that things are ticking along properly are within the remit of the government. So I think it's a very careful balance that needs to be maintained there. Listening to the general public, but not getting involved, and accepting that once a clinician says this has been done for this reason, that is correct. So I think it's a careful balance.